talked about schools, but even if you just walk
Very
out...
complicated agenda.
Does it actually mean anything at all?
Okay, this is right and wrong, but it doesn't actually follow it.
We've been in recession for a few years now.
Have any of you been impacted?
Real stories,
We learn from one another.
real issues. Is Islam a threat? And real views. This is Real Talk.
Assalamu alaikum wa rahmatullahi wa barakatuh. Beloved viewers of MTA, you're welcome to another exciting program, Real Talk Africa. And my name is Shoyoye Idris. You may have heard of social health. Perhaps you've heard of environmental health and physical health. But on today's episode of Real Talk Africa, we shall be discussing mental health and how it affects individuals in the society. I'm not here alone. I'm here with respected panelists from all walks of life and my ecstatic audience. I would like to start by introducing the first panelist within us, and that is Dr. Khalilur Rahman Abdullah. Dr. Khalilur Rahman Abdullah works with Lagos State Health Service. You're welcome, Dr. Khalilur Rahman.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. The next person I would like to introduce is our respected missionary of Ahmadiyya Muslim Jamaat Nigeria, in person of Muallim Qasim Oyekola. Muallim Qasim, you're welcome to the show.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. And the last but not the least is Dr. Oni Waliullah, who works with Lagos State University Teaching Hospital, Lagos State, Nigeria. You're welcome to this show.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Of course, I'm not going to forget my ecstatic audience. Audience, you're highly welcome to this show. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallahu khairan. In a recent development that happens some few weeks ago in Nigeria, it was reported that a student from one of the university in the east of Nigeria killed himself, and this suicide was associated to extreme mental health case. These and lots more are reasons why it is very fundamental for us to treat this topic, mental health. But before we set the ball rolling, we would like to see or to hear from the people around Nigeria.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to another episode of Real Talk Africa on Muslim Television Ahmadiyya. Today's episode is a crucial one as we are going to be tackling the often overlooked topic of mental health. Join me as I engage with people to gather their opinion, thoughts, perspective, and understanding about the issue of mental health and its impact and significance on people's health. Let's go to find out.
Mental health means psychological, social well-being, and how to handle stress.
Almost everyone goes through stress in our daily life, but one of the ways that I think you can reduce this mental stress is that maybe we should take a routine. Maybe when you can come up with an exercise every morning in the morning.
The common challenges of mental health in academic area are depression. Like depression is when you're not doing well in your academics, you feel depressed, then it can lead to suicide. Then also it's fatigue, whereby too much of workload, stress. It also leads to tiredness. So those also affect mental health of individuals.
And your parents too, like parental issues. Your parents can be fighting at home. That also affects your mental health and how you see marriage too. I feel like the mental awareness level in school is very low because like people don't really like sharing their personal issues. So they just joke about everything and people don't really take it serious like that.
Ways we can support or address mental health on youth is by creating more awareness, whereby the youth are aware of what's mental health.
The parents should have quality time with their children. So maybe when they come back from the school, they should check on the children. Whatever anything they do in the school, they should make sure they check upon them After which, maybe during some weekends, you can go on picnics to cheer up their children. There are some askar that we supposed to be doing to improve our mental health too. So when for example, the Holy Prophet Muhammad Sallallahu, then when you have a hard time, make sure you do some askar. So, for example, now if you are going through a lot of stress, just recite some askar so as to that askar we put your mind at ease to a certain level.
You're welcome back. Viewers, we are still on Real Talk Africa, and I still have my audience with me in the studio. I would like to start from you, Dr. Abdullah Khalilur Rahman. What do we mean when we say mental health? What do we understand by mental health? What do you think people should look out for when we talk about mental health, Dr. Saab?
Jazakumullahu khairan. I would like to start by saying that when we talk about health as an entity, usually we like to take our references, or we like to lay precedence on our facts from the governing body of health in the world. That's the World Health Organization. And there is a popular parlance that says that there is no health without mental health. So quickly banking on that, I would like to quickly bring some definitions into the mix. Health as a word, as a subject, what does it mean? It's defined as a state of complete physical, social, and mental health, not necessarily the absence of disease or infirmity. So when we say health, we are not saying that when we say someone is healthy, they may not necessarily be sick, yet they are not in a state of good health. So extrapolating that definition to mental health, mental health as an entity is broadly explained as a state where an individual, a singular individual, is aware, has full awareness of their capacity, their intuitive capacity. That's one. They are aware of their stressors. They are also being able to work around those stressors productively while making a significant and positive contribution to their society. So when you look at those definitions I've explained, you see that we don't necessarily have to see someone physically ill. At the same time, we do not necessarily have to see someone probably roaming around the streets quoted as a madman before we say this person is in a poor mental health state. So mental health encompasses all of that thing. Like I said, those four components. Individual being aware of his intuitive capacity. Being able to identify stressors in their individual pursuits in life. Being able to work around those stressors productively while making a positive contribution to society. So that underscores the scope of mental health in its entirety.
Interesting.
I would like to stop with that.
Thank you very much, Doctor. So invariably, you're saying that it is not necessarily that we see people who are mentally retarded before we say this person is suffering from mental health issues. Interesting. Dr. Oniwaliula, I would like to ask you, how does, when we look at, this mental health that we're talking about, what are the common indicators, or let me say challenges now, that individuals face when it comes to mental health, and how can we address these indicators as well?
Thank you very much for the question. You will realize from the definition given by Dr. Khalilur Rahman Abdullah Sahib that he has taken a broad explanation or definition of what mental health should be. So however, if we take it concisely as the awareness of mind, because all the processes he analyzed earlier, if we are following, we realize that self-awareness has to be from the mind. So which means when somebody's mind is well, we say the person actually have a mental well-being. Now, the challenges the people have in having mental well-being is they are classified as biopsychosocial factors as usually used. Bio means the biological factors could be there.
Yeah.
So such as the genetic makeup, congenital, and some other things. Then there are the major one. That one is usually classified as minor one because the biological makeup majorly are things that cannot be changed. Majorly, not all. So if somebody is born, for example, if somebody is born as a Down syndrome or somebody is born as an autist, so he can change it. So, but the one that the major factors are called psycho factors and the social factors. So psychosocial factors. So majorly, the psycho factors are the thought processes.
Oh.
So how individual thinks. So does an individual lack thinking? Does an individual having low thinking? Does an individual thinking excessively beyond what is expected? Or does an individual having a negative thought? So the thought processes is the number one. Then the second one is the feeling processes.
Okay.
So how do you feel how is the emotions? How do you feel things? How do you perceive things? So then the third one is usually the actions and reactions.
Oh.
So what are the actions you take? What are the reactions to either to environment or to whatever is coming, what you hear, what you perceive, what you see, what you do, and all those things as he earlier enumerated. So the actions and the reactions. And the last one is usually called relationship management. How do you relate with yourself first?
Yeah.
So if somebody have a disorder of relating with himself, then the person will be having a mental challenges. So it will lead to mental conditions, then mental disorders. Then once the mental disorder sets in, just as the example you gave from the beginning of this, so that will lead to things like suicidal ideations and the rest that you actually gave, in which it could resort into suicide or whatever the mental conditions is. So those are the four characteristics that are enumerated in the psycho factors, and that is psychological factors. Then for the social factors are the environment, the race, the religion. So if the environment sometimes contributes to how the health is. For example, the sleep hygiene. When we take the sleep as an health, because if an individual is not sleeping, there is what we call sleep hygiene, for example. So if an individual does not have sleep hygiene, so it means the person cannot have a mental awareness.
Oh.
It cannot have mental awareness. So one of the components of the sleep hygiene is the place you even sleep in, the environment you sleep in. So somebody that sleeps under the bridge every day, and so on, so it's going to definitely affect his mental health.
Thank you very much, Dr. Oniwaliola. Let me move to the missionary, Mualim Kozim Oyekola. One of the things that we're taught in the basics of social study is that family is one of the key social agents in our society. How does domestic activities now that comes from home, how does it affect mental health?
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Jazakallah for the question.
Yeah.
You know, Islam is a very interesting religion. It has taught us so many things with regards to what we are discussing. And not only mental health, but also physical health.
Yeah.
And everything that affects our well-being. You see, with regards to the question, using Islamic perspective, Allah the Almighty wants us to be well in everything, especially mentally. That's why Allah says believers should marry believers. Because you create serene environment. Sometimes ago, during a faith matter discussions on MTA, family issues, came up during the discussion.
Yeah.
And it was said during that program that clean environment gives children clean thoughts. I'm not quoting verbatim.
Yeah.
So clean thoughts, and they will behave well because the environment they find themselves will give them good opportunity to behave well. And who will create that? That's the parents.
Interesting.
If the exposure of the mother and the exposure of the father are negative to each other, then they will not be able to create that environment. Then, like Dr. Khalil Rahman said, that mental health also involves ability to identify stressors that affects your mental state. And if children do not find themselves in that clean environment that should have been established by the parents, then there will be stressors in the life of such children. So domestically, we should be fine. And that is what Allah the Almighty intends for us, that believers should marry believers. You'll be able to create serene environment for yourself as two individuals, for your children, if you have children eventually, and for your extended families too, whenever they come around. So nobody will have any apprehension. There will be no palpitation. There will be no anxiety in such family. So that is what Islam has created for us. So domestic life, is the beginning of everything we do. If the home is not fine, then the outside there will be a hell for whosoever is coming out from that home.
Interesting. Jazakallah, Missionary Saba. I'm still coming back to you. Dr. Khalil Rahman, can we say, as a youth, we've talked about home now. Let's say in a scenario whereby the home is settled, the home is fine, the thought process, everything is clean. And, as a youth has the tendency of going out to mix with peer, that's the other social, agent of socialization, and some other people as well. And in the situation whereby he or she mingles, can we say that there is a limit point? There is elasticity now, so to say, to how we can endure ill-gotten mental health now, and is it surmountable?
Jazakumullah khairan. I think your question, you have posed a question, and at the same time, if I would be answering, I would literally paraphrasing what you said to answer the question you posed.
Okay, let's see.
No, I'm just trying to explain the fact that the discussion is integrated.
Yes.
And what each speaker has said so far already provides an overview of how these factors that you have rightly posited, how they affect mental health and an overview of it.
Yes.
So this is it. Dr. Oni said earlier, when we talk about mental health, there is a triad of bio, psycho, social. In fact, in theory of mental health practice, there is the bio, psycho, social model of mental health.
Okay.
So when the question you've asked now, we are trying to ruminate over those social factors that contribute to mental health, whether the absence of it or the presence of it, as it is, or a perfect mental health. So peer pressure happens to be one very central ingredient or central component that goes a long way to dictate how an individual, particularly using that catchment area of the youth age, how their mental health is affected. So now, in the time before now, what was regarded as peer pressure was probably limited to, we say school, right? We say school, immediate students, colleagues, your teachers, and maybe some other minor activities. People who, apart from school, maybe you are involved in other activities. You join the Boy Scout, the Girls Brigade. In the mosque, in the Ahmadiyya Muslim Jamaat model, a member of Nasra, Atfal, amongst your peers, you are influenced in some way. But the world we live in now has become so decentralized. I could be here in Lagos State and be influenced largely by the practice of someone who is in Milwaukee, Wisconsin, in the United States of America. The world has become so decentralized that the factors that contribute to influential pressure practices have become so broadened. So this, in a way, is a negative effect to what mental health practice is. Let me quickly add this. In mental health, there are 3 P's that we usually refer to. We call something preventive factors, we call something perpetuating factors, and we call something precipitating factors.
Interesting.
See those P's, they seem somewhat related. However, they are distinct. So peer pressure, as it is one of the precipitating and at the same time perpetuating factors that helps to influence largely mental health, or as Dr. Oni has rightly put it earlier, mental wellness. So for the youth particularly, to come back to this crux of the question, for the youth particularly, peer pressure has become an integral part of what affects mental health practices. However, like you ask, can it be surmountable? Yes, it can. But it requires an interplay of different factors. Because what helps to surmount everything all circles back to one component known as resilience, mental resilience. So it's, like I said, the context of mental health, it is, you can never approach it isolatedly. It has
a lot of branches.
It's a vicious cycle. From the home, like respected Missionary Kola said earlier, to surmount mental health challenges that come from peer pressure. It's an interplay of so many things, starting from the home, from that same peer pressure groups themselves, from different distressors, and so many other factors that help to affect how one can surmount all of these mental health problems.
Thank you very much, Dr. Khalilur Rahman. Missionary Oyekola Saab, I would like to get your thought on Islam's approach to mental health challenges.
Thanks very much. It's a broad subject. Because Islam itself, going by its meaning, means peace. And anyone who is at peace and is in peace is already having mental well-being. So Islam, from day one of our life till death, prepares us against mental health, or mental illness. Let me put it that way. Because Islam prevents so many things for us. Like Dr. Abdullah said, that there are 3 P's that dictates how well we should be, mentally. And Islam has prevented us from having any negative thoughts. 1, we should realize what we have come to this world to do. If we realize that, then we'll prepare our mind towards it. And that is God. Everything will be God and God only and God alone. وَمَا خَلَقْتُ الْجِنَّ وَالْإِنسَ إِلَّا لِيَعْبُدُونِ. Allah says, I have not created jinn and man, but to worship me, to adore me, and to serve me. So if every individual realizes this, then mentally we'll be settled. Everything about us and in us will be focused towards God Almighty. That's one, and that is the root and the foundation of everything. That is what Islam has put forward for us. And then Hazrat Muslim Maud through the scheme of Tariq-e-Jadid, through the 19 demands of Tariq-e-Jadid, has also taught us that we should lead simple life. We should lead simple life. So if we understand what simple life is, then we will be calming in our approach to everything. This is the umbrella teaching of Islam with regards to how we can maintain our mental health. And it will also prevent us from going into what will be hazardous to our mental well-being.
Beloved viewers, you've heard from our panelists dishing out important messages and information as far as mental health and how we can check our mental health is concerned. One of the key things they've said here is contentment, and also having absolute belief that it is only what Allah gives that you can earn. What Allah does not give, you cannot earn it. Let me quickly, at this juncture, move towards my audience. Audience, I hope you've been following duly. So please, who have something to say to this very particular topic, mental health?
Okay, assalamu alaikum.
Wa alaikum salam.
As we all know that depression is one of the causes of mental health.
Okay.
And as a student, you are studying university, then you are reading to make up to your grade, to achieve a good grade, but it's not showing in your results, then it can lead to depression, whereby you are reading there, it's not showing in your grade. How can we overcome it? Because from depression, it can lead to suicide. So in order not to lead to those stuff, how can we overcome it as a student in university environment?
Okay, the question is taken. Let's take another audience, please.
Looking at men's mental health, concerning the issue of men opening up to other people, and not trusting them for, maybe eventual mockery or, other issues. So how can men balance up things with opening up about their problems and at the same time not facing those issues with men opening up with their problems to people?
So if I could get it correctly, how can men open up without being getting mocked? There's always this man up. So how can they do that? Is that the question, right?
Yes.
Jazakallah khairan. So Dr. Khalilullah, let's get Khalil Rahman, I beg your pardon. Let's get your thought on that.
Jazakumullah khairan. I think I had a question directed to me.
Of course.
And very great observation / question, by the way. I think to answer simply, because of the lack of time, there's something in the context of, I must quickly correct, by the way, depression is not a cause of mental health. Mental health is not a disease or a disorder. It's a scope that encapsulates different things. There's mental health as a scope. There are mental health disorders. There are mental health conditions. So depression just happens to fall under one of the mental health disorders. There are so many others. And I must quickly also state that depression, as you have put it rightly, is not a self-inflicted diagnosis. So there are mental health specialists that actually have the capacity, by virtue of training and licensing, to actually diagnose, using certain criteria, depression or other disorders. So to quickly get to your question, there's something called positive stressor. There's something called stressors. So you have those are the things that predisposes you to getting one or two or one or more other mental health conditions. So the example you gave, school, pressure of reading, get your high grades, you are reading so much, you don't seem to have the results you desire. There are so many ways to work around it. So, but going back to this question and the definition of mental health in the first place, like I said, identifying stressors. Your stressor in this case is the pressure on yourself, or the pressure that exists in the sense that you want to be a high flyer, you want to pass school well. So you are studying so hard and you're not getting your results. So you've identified that. So how do you address? So there are positive stressors, things that you can help manage your stress or your negative stressor. So how do you go about this? Identify the problem. You've done that. Number two is how measures to address it. Identify like minds. Do not suffer in silence. That is one major problem that causes a lot of these conditions. Do not suffer in silence. So it's the certainty that there's a lot of other people like you in the same shoes. They are reading on high. It's actually identify these people. Speak up. Identify with these people. That's one. Number two, when this pressure gets to a level that you feel that yourself and even your peers cannot handle, speak to professionals. The truth is, we always liken or we always equivocate this thing of, speak to a professional as, I already have a disorder. No. It is part of the ways you help to address your own inherent self by speaking to a professional. And lastly, because of time anyways, is that prioritizing self, particularly when it comes to care, mental health care is very important. Because you want to have high grades, you are studying for 18 hours a day, you end up eventually sleeping for 2 hours or 3 hours in a day. So you are doing a lot of work. You are studying for maybe 18 hours, but you're not getting enough sleep. So eventually, it's a work in futility, because when you read, the time that you're supposed to use to assimilate and process all you've read by resting, you don't get that. So ultimately, it's a work in futility. So all of this interplay have to be managed together. Speak to someone, speak to your colleagues, work in groups, identify other measures, not reading alone. You want to get to a discussion group, you want to speak to your lecturers, identify all of these and marry them together.
To find a solution.
Find a common ground that can help you address your situation.
Jazakallah khairan. We call, sometimes when you read like that, the way I said, we call it, you tend to get what we call information overload, and it could actually backfire. Jazakallah khairan. So missionary, we call us up.
Quran says, Kunu ma'a sadiqin. Be with the righteous or truthful. Underscore the word truthful or righteous. And in another verse of the Holy Quran, Allah says, Ulu qawlan sadida. One, have a group of righteous people. Then, Ulu qawlan sadida, establish good communication. So these two teachings of the Holy Quran work together. Be with those who will address your issues. Then don't bottle up. Speak out in a calmly manner and in the way that people of righteous mind will assist you. It's not only for men, also for women. Women should move with righteous women, not those who will mock other women in their presence, or those who will tell them, do this against your husband. Or men should move with righteous, not with unrighteous men. Moving with professionals of like mind, those who can assist you, are also righteous in that, in that context. Like Hazrat Muslim tells us when he was, he explained Idina Sirat al-Mustaqim, Sirat al-Ladina, and Amta alayhim, taking along chapter 4, verse 70 of the Holy Quran, that in every facet of life, you can have truthful people, prophets, martyrs, and righteous people, even in your own walk of life. So anybody that are good in that area, move with them, then they will assist you. But present yourself in a way people will not misunderstand you, so that you avoid being judged, you avoid being mocked, you avoid being embarrassed.
Jazakallah khairan to our beloved panelists for beautiful submission on mental health. Right now, before we round up the program, we'd like to get the guidance of our beloved Uzur, Hazrat Mirza Masroor Ahmad, Ayadallahu Ta'ala bin Rasulullah al-Aziz, on mental health.
We are involved too much in materialistic things. The preference order of our desires and our wishes has changed. And instead of seeking Allah's love and Allah's closeness, we are running after worldly things. This is the main cause of it. And when your desires are not fulfilled, you cannot get whatever you want, then you become frustrated. And then that frustration leads to anxiety. So this is what Allah Ta'ala has said in the Holy Quran, Allah bi zikrillahi tatma'innul qulub, that remembrance of Allah is the best way for the satisfaction of your heart. Right? So if you remember Allah, whenever you have any problem, you bow before Allah, you offer your 5 daily prayers fervently, sincerely, then Allah will give comfort and satisfy your heart, right? And resultantly, you will feel comfortable and better. And most of the patients nowadays who are having this anxiety problem are because they are too much inclined towards worldly things. So, if you try to get closer to Allah Ta'ala, then at least 80% of your anxiety will finish. Okay? So, you are lucky that Allah Ta'ala has given you the chance to be the member of that community who is following the reformer of the age, the promised Messiah, whose advent was foretold. So he has asked us that instead of running after worldly things, you try to get closer to your Creator. And that will give you satisfaction and comfort.
You're welcome back. And I would like to get some of our final thoughts with our panelists in the studio here. Dr. Oniwaliullah, would like to ask, technology is meant to be a blessing to us. A lot of youths, a lot of people spend hours, sizable number of hours on laptops, phones, and etc. What advice do you have for them? How can we, solve this problem? What is the correlation now with mental health in terms of technology is concerned?
Jazakumullah khairan, Hassan Jaza, for that beautiful questions. Recently, the studies conducted around the world have actually discovered another mental health disorders. It's called social media addictions. So there has been addictions before. We have different addictions. So they now conducted studies and discovered social media addictions. And the factors that led to the social media addictions is usually called FOMO, that the fear of missing out. So the fear of missing out. Which message I've missed out? Which discussion I've missed out? I want to go back to my social media. I want to go every time they keep going and they keep exhausting their time over this. So my advice is the Uzur Adonai Aziz has helped the members of the Ahmadiyya Muslim Jamaat to have a greater impact of the health. He has given what should be done with social media, what should not be done. The time to spend, the time not to spend. So if somebody can balance, moderation is all what we need to maintain a good mental health.
Jazakallah khairan for that beautiful submission. Missionary Yekola Sab, is there a way to strike a balance between the spiritual solution and the medical solution of mental health?
Allah bi dhikrillah tatma'innul qulub. Behold, it is only remembrance of Allah that can give you contentment, that can make you have stable mental health. When you realize that God is your creator, when you realize that you must worship God, serve Him, and along the side serve human being, not to take from human being, in quote, but to serve human being. Whatever you have, use them to serve fellow human beings, especially those who are not up to you socially, economically, and what have you. Having all this in mind, we give a person, stable mental health. And if perchance you have any, mental health issue, as a Khalifat Masih have guided, prostrate before Allah and pray to Him, then you come back alive, then you summon your mental health challenges.
Prostrate to Allah
prostrate
subhanahu wa ta'ala.
before Allah the
Go to Him and He will surely be there for you. Jazakallah khairan for that beautiful submission. Dr. Khalilur Rahman, in just a few lines, 1 or 2 lines, please, the time is against us now. What advice do you have for our youth watching this program?
All right, Jazakumullah khairan. It's definitely been an amazing time on this panel. I would circle back to where we all started.
Yeah.
I said at the beginning, there is no health without mental health.
Okay.
As a youth, particularly, never be in isolation and allow any form of mental health disorder that you may have compound on yourself. Always seek help. Seek help professionally, resort in the context of the Islamic principle, resort to the Islamic principles that would be of utmost assistance to you in guiding you through your challenges. But most importantly, to reiterate, there is no health. We cannot assign a clean slate of health to yourself if your mental health is still in jeopardy. Jazakumullahu khairan.
Jazakumullahu khairan. Gradually, we are coming closer to the end of today's episode of Real Talk Africa. We have learned so many things from our beloved panelists who have highlighted some of the challenges many of us face as far as mental health issues are concerned. And they have also preferred solution. And one of the solutions that they've preferred is that we should go back to Allah subhanahu wa ta'ala and ensure that we follow the guiding principles that Allah has laid down for Prophet Muhammad sallallahu alaihi wasallam in order to navigate through lives easily. Before we draw the curtain, I would like to appreciate our beautiful panelists for their wonderful submission. And to my ecstatic audience, I really appreciate your wonderful time with us. Jazakallah khairan for coming. Beloved viewers, this is how far we can go on today's program. For feedback, inquiries, or messages, kindly email us africa@mta.tv, africa@mta.tv. Jazakumullahu khairan. Till next time we come your way, I remain your host, Shoyoye Idris. Assalamu alaikum wa rahmatullahi wa barakatuh.